We've had an interesting one this week, haven't we, on face masks in schools, with the government evidence effectively saying that the evidence remains not conclusive. I think their own study in autumn didn't provide proof of a statistically significant impact of wearing face masks in schools. Evidence reviews say other studies have provided mixed results, but what should we do? Because it must be really challenging. I mean, wearing them's a little bit uncomfortable, but I think we can kind of get past that. But it's more that sort of face-to-face learning, you know, having to wear one in the classroom, not being able to really respond to facial expressions, particularly for children with any kind of learning disabilities, must be really difficult. Arlene, what are your thoughts? Should we be making our kids wear masks in schools?
Yeah, this is a really difficult one, and I note that the report that you're talking about, I think the difference was something like 0.6%, which is very minimal and certainly within the margin of error. I think people, and particularly older school children, could deal with face masks as long as it was for a short period of time. The reality is now people, particularly here in Northern Ireland and some of the other devolved nations, we're now expecting our children to wear masks in classrooms all of the time. And I think it's wrong for the reasons that you've already articulated in terms of engaging and learning. For teachers, it must be incredibly difficult to read how children are responding to what they're being taught. And I myself have realised once I started to wear masks and I was speaking to other people wearing masks, I must lip read a little bit because I was finding it very difficult to understand people and to hear what they were saying. And if I'm finding that, I'm sure there are many, many other people who are finding this barrier of communication really, really difficult. And I think especially for our young people, they need to be able to engage. This barrier that is surrounding them, when you see the evidence that is now coming forward that actually it's not protecting them in a way that we were told it was, I think it's very concerning. And if I can bring you back right to the start of COVID-19, and we had this debate about masks, and initially we were told, no, don't be wearing masks because actually it might actually spread the disease because you're taking masks off and touching your face. And then all of a sudden it became the norm and it was accepted as the norm. And I'm not a great believer in masks. Obviously, if you're coughing, you should cover your face and deal with that. But wearing masks all the time, I think, will have long-term impacts. Paul has already mentioned it, mental health impacts, socialisation impacts. And I think we need to be a lot more evidence-based when it comes to dealing with masks.
Yeah.